I'm Dr. Sebastian Castelli, board-certified chiropractic neurologist with Castelli Chiropractic Center. So from time to time, a patient comes into the clinic that has been told they need surgery for their scoliosis. Now in the medical community, the need for surgery is based on the severity of the curve of the scoliosis. The curve is measured on x-rays using what's called the Cobb angle method, named after the American orthopedic surgeon, John Robert Cobb. The Cobb angle shows the degree of severity between 0 degrees up to however severe the angle is. If the degree of severity of the curve is between 0 and 20 degrees, medical prescription there is to watch and wait, to not do anything now, but to see how this develops over time. That's not really a good approach in my opinion. I'd want to be a little bit more proactive and try to change the condition, but that is the medical approach. Now, if the curve is between 20 and 40 degrees, the approach is bracing. There are different types of scoliosis bracing available. Fortunately, they've gotten much better. In the past, they used to be something called the Milwaukee brace, which was awful. It's very hard and plastic and very uncomfortable. And because it's usually teenagers wearing this brace, it's, you can imagine, quite embarrassing. So for anything above 40 degrees, the medical community would recommend surgery. Surgery for scoliosis usually involves putting rods in the spine all the way from the bottom to the top and fusing those areas of the spine together permanently. They want to strengthen or straighten the spine, and there's a fear that the scoliosis would worsen to the point where it could put pressure on vital organs or on other areas that could cause problems for the patient and accelerate severe degeneration. Now, we do treat a lot of patients with scoliosis. Our approach is slightly different than that of the medical community. We're going to look at the scoliosis early on. If it's less than 20 degrees, we want to be proactive and really just keep it from getting worse. And it can worsen at any time. We've seen patients at the age of 70 or 80 who didn't get any care and their scoliosis has worsened, and the arthritis has worsened too. So you have to be proactive about it. Between 20 and 40 degrees, besides bracing it, we want to make sure we're prescribing some specific exercises and protocols to help reverse the symptoms and reverse the increasing misalignment of the spine. There's definitely things out there worth trying that can help fix that curvature. So not everyone responds in the same way, but it's definitely a better option than having surgery and metal rods in your back for the rest of your life. So guys, if you found this useful, go ahead, drop a comment. If you have a scoliosis or if you've had the surgery, let us know. I've had many patients who I still work on who have had the surgery, and we can still help them.